Vaginitis is a common condition that affects many women at some point in their lives. It refers to the inflammation or infection of the vagina, leading to discomfort and various symptoms. Understanding what vaginitis is and its causes can help women identify and seek appropriate treatment for this condition. Vaginitis occurs when there is an imbalance in the vaginal ecosystem, resulting in an overgrowth of harmful bacteria, yeast, or other microorganisms. This imbalance can be triggered by various factors such as hormonal changes, poor hygiene practices, certain medications, or even sexual activity. The symptoms of vaginitis may vary depending on the underlying cause, but commonly include itching, burning sensation, abnormal vaginal discharge, pain during urination or intercourse, and general discomfort in the vaginal area. It's important to note that these symptoms can also be indicative of other conditions, so it's crucial to consult a healthcare professional for an accurate diagnosis. Treatment for vaginitis typically involves addressing the underlying cause and may include over-the-counter or prescription medications such as antifungal creams or oral antibiotics. Additionally, adopting good hygiene practices and avoiding irritants like scented soaps or douches can help prevent future episodes of vaginitis. If you or someone experiences symptoms such as vaginal discomfort, itching, or unusual discharge, it's important to consult with a gynecologist to address the possibility of vaginitis. Vaginitis is a common condition that affects many women, causing discomfort and irritation in the vaginal area. Understanding the causes of vaginitis is crucial in order to effectively prevent and treat this condition. There are several factors that can contribute to the development of vaginitis. One of the most common causes is an imbalance in the natural bacteria present in the vagina. This imbalance can be triggered by a variety of factors, including poor hygiene, the use of scented products or harsh soaps, and wearing tight or non-breathable clothing. Another potential cause of vaginitis is a yeast infection, which occurs when there is an overgrowth of yeast in the vagina. This can be caused by a weakened immune system, hormonal changes, or certain medications such as antibiotics or oral contraceptives. Sexually transmitted infections, STIs, can also lead to vaginitis. Infections such as trichomoniasis, gonorrhea, chlamydia, and herpes can cause inflammation and irritation in the vaginal area. Additionally, certain lifestyle factors can increase the risk of developing vaginitis. These include douching, which disrupts the natural balance of bacteria, using intrauterine devices, IUDs, having multiple sexual partners, and engaging in unprotected sex. Understanding the risk factors associated with vaginitis is crucial for women's health and well-being. Vaginitis refers to the inflammation or infection of the vagina, which can cause discomfort and disrupt daily life. Several risk factors contribute to the development of vaginitis. One significant factor is poor hygiene practices, such as not maintaining proper cleanliness or using harsh soaps that disturb the natural balance of vaginal flora. Additionally, engaging in unprotected sexual activity, multiple sexual partners, or having a new sexual partner can increase the risk of developing vaginitis. Certain medical conditions, such as diabetes or a weakened immune system, also make individuals more susceptible to vaginal infections. Hormonal changes during pregnancy or menopause can alter the vaginal environment and increase vulnerability to vaginitis. It is worth noting that certain lifestyle choices can also play a role in developing vaginitis. Wearing tight-fitting clothing or synthetic underwear that doesn't allow proper airflow may create an environment conducive to infection. Moreover, excessive douching or using scented feminine products can disrupt the natural pH balance of the vagina and lead to inflammation. By understanding these risk factors associated with vaginitis, women can take proactive steps towards prevention. One of the most common symptoms of vaginitis is vaginal itching or irritation. This persistent itchiness can cause discomfort and interfere with daily activities. Additionally, women may experience abnormal vaginal discharge, which can vary in color, consistency, and odor. Changes in the discharge may indicate an infection or inflammation. Another symptom to watch out for is pain or discomfort during urination or sexual intercourse. Vaginitis can cause inflammation in the vaginal area, leading to these uncomfortable sensations. It is important to note that not all cases of vaginitis present with the same set of symptoms. Some women may experience all of the mentioned symptoms, while others may only have one or two. It is advisable to consult a healthcare professional if you are experiencing any unusual symptoms related to your vaginal health. Diagnosing vaginitis can be a complex process, but with the right information and guidance, healthcare professionals can accurately identify and treat this common condition. By understanding the various diagnostic methods available, both patients and doctors can work together to ensure a swift and effective resolution. When it comes to diagnosing vaginitis, healthcare providers typically start by taking a detailed medical history from the patient. This includes asking about symptoms, previous infections or conditions, sexual activity, hygiene habits, and any recent changes in medication or lifestyle. This information helps to establish a comprehensive picture of the patient's health and aids in determining potential causes of their symptoms. In addition to gathering medical history, a physical examination is often performed. During this examination, the healthcare provider may visually assess the external genital area for signs of inflammation or irritation. They may also use a speculum to examine the vaginal walls for any abnormalities such as redness, discharge, or lesions. To further aid in diagnosis, laboratory tests are commonly utilized. These tests may include microscopic evaluation of vaginal swabs or samples to identify specific pathogens, such as yeast or bacteria. Additionally, pH testing may be conducted to measure the acidity level within the vagina, as imbalances can indicate certain types of infections. When it comes to the treatment of vaginitis, it is important to address the underlying cause and provide effective relief for the symptoms. Vaginitis refers to the inflammation of the vagina, often caused by infections, hormonal changes, or irritants. The treatment options for vaginitis vary depending on the specific cause. For example, if the condition is caused by a bacterial infection, such as bacterial vaginosis, antibiotics may be prescribed to eliminate the harmful bacteria and restore a healthy balance in the vaginal flora. On the other hand, if a yeast infection is identified as the culprit, antifungal medications can be used to combat the overgrowth of yeast. In addition to medication, there are also self-care measures that can help alleviate symptoms and promote healing. These include practicing good hygiene by keeping the genital area clean and dry, avoiding irritants such as scented products or douches, wearing breathable cotton underwear, and maintaining a healthy diet. Prevention is key when it comes to managing and reducing the risk of vaginitis. By taking proactive steps, individuals can significantly decrease their chances of developing this common vaginal infection. Maintaining good hygiene practices is crucial in preventing vaginitis. This includes washing the genital area with mild, fragrance-free soap and water, avoiding douching or using scented feminine products that can disrupt the natural balance of bacteria in the vagina. Wearing breathable cotton underwear and avoiding tight-fitting clothing can also help prevent vaginitis. These measures promote proper airflow and reduce moisture buildup, creating an environment less favorable for bacterial or yeast overgrowth. Practicing safe sex by using condoms and regularly getting tested for sexually transmitted infections, STIs, is another important aspect of prevention. Many STIs can lead to vaginitis if left untreated, so it's essential to prioritize